So then the petals start to fall and everything kind of looks a little tired. And after this, it withers. But actually now, it's still us, darling. No, I think I'm here. I'm here. Where am I? I'm here. I'm here.
Hi, I'm Tessa Prieto-Valdes, and welcome to a wonderful afternoon here at my home for a super special Private Matters with Dr. Adrian Gaspar. We are going to have a wonderful talk about feminine hygiene and health and wellness and the wonderful things that you don't want to hear about, but you're always wanting to know about the vaginal exciting part of your life down there. We are now here with a wonderful multi-awarded gynecologist from Argentina, Dr. Adrian Gaspar.
Yay!
Welcome to the Philippines. And right beside him is the wonderful Doctor to the Stars and me, my ninang, Dr. Vicki Belo. Yay!
So happy to be here. You know why? I heard he's so handsome. It's true, right?
Yes, guapo, mucho.
Es muy guapo, es el crush del
Sí.
obstetricians, they said.
Welcome, Dr. Gaspar, to the Philippines. This is, I heard, your first time here.
My first time in
Wow, okay.
wonderful country.
We're talking about vaginal reconstruction.
Absolutely.
All right,
That is the
okay.
word.
And you are the expert, we hear.
Well, my practice features actually vaginal rejuvenation and vaginal aesthetic procedures.
Well, let's talk about the local scene. Okay.
Sometimes they'll very meekly say,
Yes.
you know, I have urinary incontinence. They will talk, do you have anything for that? And then I
right,
will,
yeah,
or
yeah,
if
yeah.
I talk to them and they've had 4 children or more, then I say, do you want, you know, I don't know if you have any problems. It's a very soft
Yes,
way of
you know,
doing
I think
things.
it just really stems out from us being like really intrinsically very shy.
That's
and
the Asian
quiet
part
and
of us.
The Asian, I think, you know. What's the scientific explanation of that?
Well, the scientific explanation is 2 mechanisms. Continence depends on 2 factors. One is the anatomical part in which the bladder neck, the urethra lose their initial position. So I have a certain hypermobility that may cause this leakage during an effort. That is the anatomical part. The laser, the radiofrequency treatment, improving the firmness, the tightness of that area, give to this mechanism more resistance, more strength.
Yes.
And on the other hand, the other mechanism of continence consists of the performance of one sphincter that depends on the trophism of the urethra. So we are improving also the urethral trophism because the warming process has a local regional effect. So you are improving the trophism in the vagina and also periurethral. So basically you will not cure the incontinence, but you are improving continence.
Yes,
So this
right.
is the mechanism of action. You are improving women continence. The treatment consists of the application. In the case of the laser, we introduce a speculum probe, a crystal probe. Through that probe, we insert a special extension to deliver the energy inside the vaginal canal, circularly or angular, depends on which phase, which wall do we want to treat. We do 2 to 4 passes, complete passes. The vagina length no more than 10 centimeters at rest. This is the maximum length of the vagina.
Can you imagine when a baby comes out of there?
No, but it's elastic.
I know.
Yes,
right?
it's when your bones open, your hips open, or
Yeah.
your bones actually.
And then we treat the internal part and then we treat the external to promote tightening. With radiofrequency it's similar, but in radiofrequency we don't use a speculum. We insert the handpiece, yes, and we use a certain gel, and we do the passes and the certain time, delivering the energy, and that's it.
Okay, let's talk about the procedure and really just briefly, what is it all about?
2 types of patients. This is the reason why this specialty is called aesthetic gynecology and functional and regenerative gynecology. What we are doing with this type of problems? Well, we are using lasers,
Yes.
radiofrequency, which are sources of heat just by creating a superficial warming process in the external part of the genitals, in the vulva and in the vagina, in the vaginal canal, we can promote two things. On the one hand, tightening. So the vaginal mucosa will appear over time, tighter, younger, more elastic, with more lubrication, and also in the external part of the genital area. So the skin will rejuvenate. And finally, that is the most important thing, that they will improve their arousal desire,
All of a sudden,
sensitivity, orgasm.
So when you're a virgin, right, Dr. Gaspar, do you agree with me? You're very tight. You're a bud. There's nothing loose. It all looks pretty.
and it's firm.
When you start getting married, you have one baby or two babies, it's kind of a little more open, right? But it's still pretty.
Yes.
Now, when you've already given birth and you're already, you know, the face and the vagina, they're all skin.
Now I understand.
Correct?
Why
So
she brought
that's why I'm
power.
here. No, so everything sags, everything gets older. It's not just your face. Of course, your whole body also sags, but including that private area down there, it also opens up and
She gave
begins
us
to
a better example.
sag. Yeah. So then the
Guys,
petals start to fall and everything kind of looks a little
if you touch
tired.
it,
And
it's
after
not
this,
so
it withers. But actually now, it's still us, darling. No, I think
we're
I'm
still
here.
a pink
I'm
ant.
no, I'm
We are
here. Where
still
am
a
I? I'm
beautiful
here.
flower.
I'm here.
Do you have to be a certain age or a candidate for something? Is everyone a candidate for this treatment?
Yes, absolutely. I have patients, younger women, after deliveries, for example, they started feeling dryness, and also after breastfeeding, they noticed that the sensitivity
Yes.
decreases and over time. And they're young, they're 35, 38 years old.
How many treatments are you talking about?
Normally, 2 sessions, 30
Sessions.
days apart, will be enough.
Right.
And then the maintenance, you can do 1 session annually if necessary, depends on the patients. Because at the age of 70, 80, or
Right.
the vagina won't tolerate friction.
Oh my God.
And probably hormones
Yes.
won't,
Oh my God,
won't
I'm like
help.
closing my legs.
So
Yes, I know
lasers,
that.
radio frequency, can definitely bring a solution for these patients.
So it's sort of an outpatient, then you're saying?
It's a very outpatient procedure. It
Yeah.
takes what, 30 minutes, I think?
10 to 12 minutes. And in Argentina and in Latin America, also in the States, 9 out of 10 women
Yes.
prefer this type of non-invasive walk-in, walk-out procedures.
But the women out there always ask me, when can I have sex? How much after?
Well, in my experience, 3 days, it's enough.
You rest
Uh,
first.
just
Rest
rest.
first for 3 days.
Yeah.
The problem,
And then you resurrect.
the problem we have in
Yeah,
Argentina, no, but
exactly.
we have the
Or
problem.
God made it, make it 7 days. So
Yes,
on the
because
seventh day, enjoy.
if I say to my patients only 3 days, they will do 1. So I say to them 7 to 3.
A lot of women there also are afraid of pain.
Mm-hmm.
What kind, or from 1 to 10?
Well,
What, I mean, I'm sure you can't say there's no pain.
no, the procedure is completely painless.
Yes, it's painless.
Completely painless. Some women, no more than 10% of them, may feel the warming process mostly at the level of the lower part of the vagina and the external genitalia. Because of the aging process, there is certain atrophy at that level. So we can use a little bit of anesthetic cream in that
Yes.
case. But it's,
You don't even knock out the patient. It's just a topical.
yeah,
anesthesia.
topical cream.
A cream.
If necessary, because my practice, in my experience, I don't use anesthetic.
Yeah, no,
I don't.
we don't
no,
either.
No, we don't
There's
use it.
nothing, you don't feel it.
You don't
right?
feel it.
It's
And
amazing.
how long do you put like a cream after or nothing? Or
It's not necessary
What's the maintenance out of this?
Immediately after the procedure, if the patient is after their menopause, sometimes if I have used enough energy, I prescribe some ovules to hydrate immediately to avoid any itching. But normally I don't prescribe anything, just to avoid sex for 3 days,
Yes.
or impact,
Yeah, any impact.
any impact for 3 days.
Right.
So,
I want to talk about
I
orgasm.
know.
The lack of hormones, there is a lack of sensitivity in the majority of the patients. This does not mean that you cannot have orgasm, means that probably patients may need more time of stimulation. When you do a warming process,
I know, and you know what? To just disrupt some men, after 3 minutes, they're like, what? You know, me, I need like sensation and music and candles and everything. And now as I get older, I need even more sensation.
Well,
now I have a solution.
we have a solution because we've been using, this is the concept of regenerative gynecology. We are promoting the reactivation of the sensitivity of these areas using the treatment of the G-spot and the O-shot.
Can I hug you, doctor?
The O-shot. I like that, the O-shot. Okay, the O-shot is the orgasmic
we inject
shot.
with local anesthetic cream, we inject in the external genitalia growth factor from autologous blood from the patient here, paraclitoral area.
Injection like inside, or are you just
Beneath,
doing a
you cut the
pudge, or-
clitoris, and beneath the clitoris and each lateral part of clitoris.
Okay.
And believe me, that with a superficial warming process, in 10 days your patients will love you.
So, Doctora, what do you actually call this treatment when I go to you? What do I say?
We
Doctor,
call
and I-
it vaginal rejuvenation. And
Can you just
something.
call it flower arrangement?
Oh, that's what we call it.
Pelvic
here.
floor-
That's why
pelvic
I
floor
thought of the
dysfunction
flowers.
too.
Yes. The outside actually is amazing for me. In the beginning, it was all about the inside, the wetness, the tightness, the urinary incontinence. But now it's also about the outside. You want to feel confident that when
Yes.
when your
presented.
husband, since I'm Christian, it has to be a husband. When your husband is serving you,
Yes.
right, that they will see something beautiful and not get turned off, right? So,
yeah.
so external flower arrangement is also important. We call it flower arrangement here.
I love that. I've learned something new today,
Yeah.
before and after.
Wow. Well, thank you so much, Dr. Gaspar. Let's all clap for
Yeah,
Dr.
thank you for inventing this
and
procedure
Dr.
for
Vicki
women and for men.
Belo. Because now, all you women out there, what are you waiting for? It's there. Our pleasure, our quality of life. If you want to save your marriage, if you want to get married and be happy, you know where to go, to Dr. Vicki Belo.
Oh,
in
thank you,
all
Mainana.
the- Yes, in all
Will I
the
see you
places.
there?
Yes.
Okay.
I am going to go there right now. Well, thank you so much. This has been a wonderful and very informative, I'm sure everyone out there, to SpectroMed. Thank you so much for having this and opening this topic, which is very vital to our, well-being as a woman of style and beauty, like my Dr. Vicki Belo. Thank you
And
so much.
Tessa.
Guys.
Thank you. It's a pleasure.